If you're watching this video, chances are you have concerns about ADHD, either about yourself or someone in your life. And so in this HelloLife moment with Dr. Jeffrey Chamberlain, family medicine specialist, I think it's interesting. We all want, if we think that there's a problem, we want a report generated to tell me yes or no and what is the solution. So let's talk about what sort of specialists you would recommend to diagnose and treat ADHD.
Usually I recommend first, if you have concerns of seeing either your family doctor or pediatrician, or if you're an adult, your internal medicine doctor, in talking to them about it. A lot of us, we see a lot of ADHD, and so are pretty comfortable diagnosing it. But on top of that, we want to make sure there isn't some other, something else that looks like ADHD, or some other comorbid factor such as depression, anxiety, learning disabilities. In that case, a lot of times what we'll do is send you to a clinical psychologist, someone who sees tons of people with ADHD and other issues. They formally test you, looking not just at ADHD symptoms, but just across the board, a lot of different things, to make sure that there isn't some emotional problem going on, that there isn't a learning disability or something like that causing the problem.
Well, it's interesting. A friend of mine, her daughter was suspected to be suffering from ADHD, and that diagnosis was delivered at the school level, and the recommendation came from the school. I think this child needs to be put in a special circumstance and have medications be applied. Is that where it should be diagnosed, at the school level, or just concerns raised and then brought up to a more professional level?
Yes and no. Sometimes, depending on the level, sometimes it's just the teacher saying, oh, I know this kid has ADHD because I'm a teacher, I see kids with ADHD, I know they have. And that's a good screening tool in the sense of, if a teacher thinks their kid has ADHD, it'd be a good idea to get it formally evaluated, because they do see a lot of people, but the teachers aren't experienced in all the diagnoses that are out there,
right, and
they might just be labeling troubled kids as having ADHD. Some school systems actually have formal testing done. Like here in Grand Rapids, we actually do, or through Kenosha, they do formal psychological testing, they do formal learning disability testing. And so sometimes through the school system is actually who's paying for having the formal testing done. If that's set up in your community, then getting that formal testing through the school system would be a good idea, because it might be the only way to really pay for it.
Makes good sense. And so really the onus is on the parent to really take charge here, to not just accept the first diagnosis. But you know what? You've already demonstrated that proclivity by diving deep right here at HelloLife.net, where we're all about matching your commitment to a healthy lifestyle. Thanks, Doc.
You're welcome.